Good day, people. We're here to talk about assessment. And so when we're looking at assessment, what we need to understand is that we need some way to identify what is going well with the patient and what is not going as well with the patient. Now, in osteopathic manual therapy and in other therapeutic modalities, what really matters is movement. How far can the structure that's being investigated move? Can it move as far as it's supposed to be able to move, or does it move less than it's supposed to be able to move? If it doesn't move as far as it's supposed to be able to move, or as well or as smooth, then we have a motion issue, and that's what we really work on. As far as assessment is concerned, we have a few concepts that we're going to flesh out through these videos. Okay, so this will be our general overview, and then each of the videos will further expand on this. What we're looking at is we need to look at the macro, the large picture, which will identify the intermediate or the medium and the smaller problem. So the macro will identify the micro. We'll talk about that as we go. We need to have a clear algorithm. Okay? We need to see in order what's going on with the body. So we need to have some kind of hierarchy, and we'll talk about that as we go. But the biggest thing is that we need a clear-cut algorithm, something whereby we can consistently go through it to identify problems, to go from the macro to the micro, or the big to the medium into the small, or from the big to the small, or whatever we need to do. But we need a clear-cut algorithm, and that's what these videos are here to do. So what we'll do is we'll break off into those videos now in series, and we'll flesh out more of what we're talking about with that. But just as the general overarching theme here, we need a clear-cut pattern, and when that pattern doesn't work, we know it doesn't work, and we can create another pattern or another algorithm. And we also need to consider that the macro, the big, identifies the small problem. So we go from big to small, and that's what we need to keep in mind. Those are the two overarching themes that we need to keep in mind here. So what we're looking at here is just the general concept that large motions will help us identify small problems, aka the macro will help us identify the micro. So what we're doing is just a very general demonstration of a patient active motion, a large motion that can help us find where we should look more accurately. So the macro will help us go to the intermediate or the micro. Okay, so what we're going to have you do is take your right ear to your right shoulder and then bend to the right. Okay, relatively free. Get a nice C curve, not perfectly visible just because of shadows, and that's fine. We're going to have you come back to the middle, bend your left ear to your left shoulder, and then bend to the left. Okay? Now our patient does both relatively well, but if we look at this area right here, he doesn't collapse as well on the left as he does on the right. So we'll just display that, go to the right, same deal. Moves fairly well over his right side. Now we come back to the left just so we have some better timing, come back. He just doesn't collapse as well over the left. So if we were to look at this patient, we've done a big motion, we've had him move in the coronal plane, right? We've had him side bend to the left and to the right, and what it's identified for us is that the left side of the lumbar region and the left lower thoracic region is worth more investigation because it isn't moving as freely as on the right side, so it's worth more investigation. So the concept that we're just trying to show again in a repeated fashion is that big motions will allow us to find out where smaller problems may be. So in his case, we've done a big motion, or large, global, however you want to term it, and we've identified a medium-sized region. Okay, so the medium-sized region would be the left side, right about here. So we're just demonstrating that concept.